Hi, my name is Desiree Stringer and I'll be doing the bed bath today. I'll close the door, secure privacy. Hi, I'm Desiree Stringer and I'm going to be your student nurse today. Can I get your name?
I'm Cameron Carden.
Alrighty, when's your birthday?
February 28th, 2000.
Alrighty. I'm going to come over here and wash my hands real quick. And I'm going to put my gloves on. Okay, Cameron, today I'll be giving you a full bath and I'm also going to be cleaning your teeth.
Alright.
And your fingernails and your toes.
Okay.
Do you have any questions or anything before I get started?
I don't.
Alright. I'm going to place this on your bath blanket. This will give you some privacy. Okay, if you want to hold this bath blanket while I take out this blanket and sheet from you. And I'm going to keep these just rolled up at the end of the bed because they're still clean and not soiled. We're going to use them, put them back on when we are done with our bath. Alright, Cameron, you can let that go real quick. I'm going to untie your gown and take that off you.
Alright.
Then I'll pull it off your arms on both sides. Then I'll get you to hold it. Alright, come over here and pull that gown all the way down. And I would dispose of it in a linen basket. Alright. I'm going to replace your pillow with this rag so it doesn't get the bed wet. You can go ahead and place that head down. Okay? And I'm going to get started with your eyes. You can close it for me. I'm going to go from the inside to the out. Washing it real good. And then I'm going to clean your face. And I would use soap if they wanted soap, and I wouldn't use soap if they didn't. Alright. And then I would get a new rag. I would rinse that off. And then I would dry it. And also, if the patient is unconscious, I would do the same exact routine, except at the end, I would put eye drops in their eyes. Alrighty. Let me get started with your arms. Place that under you. Let me get my rag. I'm going to clean those hands real good, getting in between those fingers. And then we're just going to go all the way up the body, washing it. Also want to get those armpits real good. Then I would rinse it. And then I would dry it. Making sure I stay getting in between those fingers. And in those armpits. Okay. I'm going to go around and do your other arm. Okay, let me get your lift up. Go ahead and put it down. Get those fingers real good. And then hands, and take big strokes up. Washing it really good. Get in that armpit. Then I would rinse it. And then I would dry it. Okay? And then I would also apply deodorant to his armpits. Alrighty, Cameron, I'm going to take this sheet down to your waist so I can get that chest and stomach clean. Okay. And wash it good. And if it's a female, you would want to hold their breast up and get under those creases. And also if it is a bigger person, you would want to hold it up and get under their creases. And then I would rinse it. And then I would dry it. Okay? Mr. Carden, if you could roll over to your side, I'm going to clean your back for you real quick. Make sure I'm keeping privacy on. Okay? And I'll take big strokes, wash that back real good. Then I would rinse it. Alrighty, you can lay back down, Mr. Carden. I'm going to go ahead and cover you back up. And take this towel from me. I'm going to get started on your legs. Okay, I'm going to lift this leg up right here. And I would want to go from feet up. Then I want to rinse it. And then I want to dry it. Alrighty, while I'm down here, I want to get those feet. Throw the toes back. I want to get in between the toes very good while I'm washing them. And then I would rinse them. And then I would dry them. Make sure you dry between the toes really good. Alrighty, then I'm going to move to this other leg. Cover this one back up. Okay, pick your leg up. And I would want to clean this leg just like the other one, washing it real good. And then I would want to rinse it. And then I would want to dry it. And I would want to get those feet again on the side. Get in between the toes really good. And then I would want to rinse those feet off. And then I would want to dry those feet. Okay. And then you would go to the perineal area, and you would want the women to have their feet up and spread open so you could clean in there very good. You would want to use a new rag every time you wipe, or a different side of the rag just so it doesn't contaminate. You would also want to move front to back, and you just want to make sure you get in between each side really good. And also on the men, you want to hold the shaft and clean in a circular position of the head. You want to clean that shaft down. Get their inner thighs really good when cleaning, and you also want to clean the bottom area of the man, the sputum. And then you would want the patient to roll over, and you would want to clean their buttocks area. You would want to clean from the cheek to the inside because it is less clean to most clean to less clean doing that, and you would want to get in that crease very good while you're doing that. Then you would want to dispose of the gloves, and you want to wash your hands to start on the oral care. On the oral care, you have a dependent and an independent. The dependent, you're going to have to help them throughout all the steps, but the independent, they can do it all themselves. With the independent, the nurse will come in, will bring all the supplies, the toothbrush, toothpaste, a cup of water, a basil, and mouthwash. And they would allow the patient to brush their teeth. They would watch them, let them know if they needed to brush it correct form, and then they would also let them floss, and if they wanted mouthwash, they could have mouthwash. For the dependent, the nurse will brush their teeth for them. They would hold the thing up for them to sit in. They would floss for them, and if they wanted mouthwash, they would allow them to have mouthwash. For an unconscious patient, you would lay them on their side so they won't swallow any of that. You would have a tube that will suck out any excess water that they have, or any excess toothpaste, mouthwash, or anything like that. You would want to brush your teeth like you regularly brush your own teeth. You would make sure you get it really good. You don't want to gag them. And you would want to get foam and stick it in their gums. And you also, before you do the oral care, you want to look inside their mouth with a flashlight, make sure they don't have anything wrong with their gums, no bleeding, no wounds or anything in their mouth. And for dentures, you would also get a swab and go around in their mouth for the unconscious person. For dentures, you would use your index finger and your thumb, and you would get a gauze, and you would just sit there and wiggle it around until it came unloose from that glue. You would put it in a cup. You would do the top first, then you would do the bottom. You would lift up off that bottom. You would take them to the sink. You would place a rag down in the sink, and you would get that patient to, like, if the rag's in the sink, in case you drop the dentures, you would clean those dentures like you regularly do. You would also clean where it touched the gum in the roof of their mouth. You'd bring the dentures back to the patient, and you would ask if they wanted any of that adhesive lubricant to put it in, stick it in the mouth, and they would say yes or no. And then you would ask if they want mouthwash. If they do, you can allow them to have mouthwash. And then I'm going to go ahead and put your new gown back on. So here's your new gown. You would start with, if you had an injured arm, you would start with that one first. So you're going to put your arms through it, and you would have the gown laying over the bath blanket. And you would just pull that bath blanket down, and then dispose it in the linen hamper. Also, I'm going to give you your pillow back. And then for oral care, you want to sit them up in an upright position. Unless they're unconscious, they'll be rolled over flat on their bed. And also, we're going to do those fingers and toes. You're going to bring a basil and warm water, and you're going to want to stick their hand in it and let it soak 5 to 10 minutes on the fingers and the toes. This allows the nails to get soft, so it's easier to clean. You also want to get utensil and clean under the nails, all of his nails and his toenails, because there's a lot of bacteria and stuff that grows under there. Then you want to clip the nails down where you can't see it past the fingertips. You don't want to cut too short because that could hurt the patient, and you don't want to have them too long. You want to do that for the fingers and the toes. Then I'm going to cover patient back up. I would make sure my side rails were back up from the sides that I was doing it on. And I would make sure the call light was in reach and make sure he was fine and everything. And I would go take my gloves off, perform hand hygiene, and write it down in the charts that he got his bath today.